So ECT, usually electroconvulsive therapy, is very effective mode of treatment, very safe, very rapid. But its effect in treatment of anxiety and related disorders, no, it is not effective usually. So the main lines of treatment, usually it's psychotherapy, like CBT, cognitive behavioral therapy. If the condition is mild to moderate, CBT is enough. And if it's moderate to severe, we need psychopharmacology. We need to intervene psychopharmacologically. The most commonly drugs used is SSRIs, selective serotonin reuptake inhibitors, like paroxetine, escitalopram, sertraline, fluoxetine. Others like SNRIs, serotonin noradrenaline reuptake inhibitors, and some tricyclic antidepressants like clomipramine in treatment of OCD. Sometimes we need benzodiazepines for short duration, but it is not preferred for fear of dependence. Put in your mind that not all patients respond from the first trial. Okay, we have guidelines to deal with the patient, to choose the adequate drug for the patient, but the interaction between the drug and the body differs from a patient to another. So we can use treatment, but to assess the drug, we need about 2 to 6 weeks to start to have its effect. After finishing these weeks, we can judge, okay, this patient didn't respond well. Can we increase the dose? Can we have augmentation? Can we replace it with another drug according to the assessment? After being well, alhamdulillah, now he responded to the treatment and now he is fine. We have to continue the drug for 1 year at least 1 year before gradual withdrawal of the drug, if we find that the patient is not suffering totally from any symptoms. Sometimes we need to prolong the duration, but at least we need the duration to be for 1 year. The drugs are not addictive, inshallah, except for these benzodiazepines. SSRIs, SNRIs, tricyclic antidepressants usually are safe drugs. Of course, they have side effects like GIT symptoms, sometimes headache, sleep troubles. It can affect sexuality, but usually it is mild to moderate and for short duration, and it's subside. And it can be managed, inshallah. Remember that P equal P. Drugs are not a sign of weakness. Using drugs doesn't mean that I have weak will. No. Again, being suffering from anxiety means that you are strong. And one of the being strong, signs of being strong, that you say to yourself, okay, now I need help. Now I need to intervene. I'm performing certain type of exercise, and this exercise makes my body feels fatigue and pain. Now I'm going to receive this drug, the analgesic drug, to make me free of pain, to continue the training. It is the same for the psychiatric drugs. I'm training with anxiety, and this anxiety makes me suffering from pain. So I have to receive certain drugs to minimize my pain, so as I can continue my training adequately, inshallah. And this is a sign of strength. So receiving medications doesn't mean that you are weak. No, it emphasizes that you are strong, inshallah, when you are receiving it under the supervision of the doctor, and the doctor and you arrange this receiving the drug with the doctor and following up this drug with him or her. So as a summary, we said that we are dealing with a prevalent conditions. Anxiety disorders are prevalent. It has bad impact if I didn't deal with it adequately. It has a bad impact, but if I dealt with it adequately and I dealt with it as a way of training, so it will be of beneficial effect for me. These conditions are under-detected and have improper attitude. They said that it is a sign of weakness, and this is totally wrong. Usually it is caused by interaction between biological predisposition and psychosocial factors. And we talked about clinical features of it. We said that we have excessive worry and fear, and how to measure excessiveness. It is a change of myself for a prolonged duration and affects my quality of life. Inside is intact, and no psychotic features are present. Psychotic features are absent in anxiety disorders. And we talked about different types of anxiety disorders that differs according to the precipitator of the anxious or fear mood, according to the severity of the somatic symptoms, according to the course of the fear. We have generalized anxiety disorder, panic disorder, social anxiety disorder, previously known as social phobia, specific phobia, agoraphobia. This is the most important types, and other types that it was present. They were present in the anxiety disorders previously, and now they are separated. And that's to say, we are saying anxiety and related disorders like obsessive compulsive disorder and post-traumatic stress disorder. We talked about differential diagnosis from normal fear. We have, and it is very important to exclude that this anxiety disorders is not due to another medical condition or the active effect of substance. To differentiate other different types of anxiety disorders from each other, putting in our minds that comorbidities between different types of anxiety disorders are common, and comorbidity with depression is common. And lastly, to exclude it from anxiety symptoms in another psychiatric disorders like psychotic disorders. We talked about assessment and why we do assessment by history examination, mental examination, physical examination, and investigation. We do for differential diagnosis, for a treatment choice and follow-up, for associated conditions, and put in our minds that we have to respect somatic symptoms and for medical legal reasons, and we have no diagnostic tests in anxiety disorders. And we talked about treatment, hospitalization, and ECT. We usually don't need them. We use psychotherapy and psychopharmacology, and we talked about certain items in psychopharmacology. It usually needs 2 to 6 months to start. If the patient responds, he needs to continue medication at least 1 year while he is fine, because stoppage of medication before that can lead to appearance of symptoms again. It is not addictive, and it is not a sign of weakness. Please put in your mind that P equal P, pain equal power. Put in your mind to respect somatic complaints, and put in your mind to exclude, as I said, organicity. And we said that organicity is not a precise name, because actually primary psychiatric disorders are organic, not functional as the previous classification. But for simplicity, we can use it. We mean by organicity that these disorders is not due to another medical condition or the active effect of substance. We have to exclude it as a part of diagnosis. These 3 items are very important to put in your mind. Very, very important. After finishing your psychiatric training and finishing your exams, just put these items in your mind. P equal P. Respect somatic complaints. Before saying that this somatic complaint is part of the psychiatric illness, you have to exclude comorbid organic condition that can cause these somatic symptoms, and to exclude that this psychiatric disorder is not due to another medical condition or not due to the active effect of substance. جزاكم الله خيرا. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. السلام عليكم ورحمة الله وبركاته.